HIMSS16 is a place where people leverage this platform to make news, make big announcements, and there's several of those that are coming out from companies that are out here on the exhibition floor, as well as the government. There's new funding coming. I think we all thought that meaningful use and the incentives and all had run their course, but new announcement today in terms of very significant federal funding for those providers like behavioral health hospitals that previously were not eligible for EHR incentive funding, now receiving some. So that's big news, and they've used the platform here today to announce that. We've also got things going on that I'm going to say oftentimes may be under the radar of a lot of our attendees. We had a summit of Mideast IT representatives. We had a summit of Latin American IT executives. So the HIMSS conference has become very global, and a lot of things going on around here, really addressing a whole lot of different things and different parts of the world. What I'm hearing around the hall today, around the whole convention, is announcements of major substance from vendor companies in terms of new product launches, from the federal government in terms of new policies. And that's really, I think, today's big news is funding from the federal government for EHR adoption for those providers who previously were ineligible to receive that EHR adoption incentive funding. So major new program, major new dollars coming when, as I say, we sort of thought that train had come to a halt. Major change in terms of where the policy direction's going. If we think about what's been happening over the last 8 years now, Obama administration has really been hugely supportive of technology and healthcare. They're in the final year of their administration, and so they're focused on their messages for this last year. So the funding's a part of that. Significant changes in payment, very much a part of the conversations from Secretary Burwell last night. Karen DeSalvo, the national coordinator, this morning's keynote, really focusing on those new final year messages of here are the things that we're going to do in terms of leaving the Obama legacy behind for the rest of us in terms of what's going to happen in healthcare. And it really will have ramifications for the next number of years, regardless of who moves into the White House next January.